to learn a little bit now. That's okay. So here we go. So I'm going to just walk us through just a couple points. This is a presentation from something else, so I'm going to kind of speed through the first two bullet points and make it to the last one. But this is all to kind of present how MDH has become involved with CHWs and kind of our philosophy on how we see ourselves as a supportive institution to CHWs, because excuse me, we know a lot of work has already been done in this field. And so we're coming in just to offer our support where we can. So this is meant to be big and scary. This is a logic model that we pulled together with partners, many of whom are on this call, to really think through how do we get to being a state where we are fully supportive of the CHW profession. And we talked through kind of all of the different steps that are going to need to take place so that we have a sustainable, strong CHW infrastructure all across Minnesota. And so what we did was that logic model, that big chart, really focuses in on 5 different buckets that we think need attention in order to have a statewide strong CHW system in place. And those buckets are networking, collaboration, and strategic planning. The second bucket is continuing education and career development. The third bucket is supportive evidence-based models. The fourth bucket is assessment and evaluation. And the fifth bucket is communication, dissemination, and sustainability. So we believe if we have initiatives not just led by MDH, but led by many of the organizations that are on this call, the educational institutions, and of course, the Minnesota CHW Alliance, in partnership, if we work on different initiatives in each of these buckets, we really believe that we will be growing towards a strong CHW infrastructure. So this is one quick plug for something that's going on right now in the legislature. We have a proposal that I believe it's stayed in the Senate side of things. It didn't make it through the House proposal, but it's in the Senate proposal, which is still fine. It's in there, that's what counts. But we're really trying to get some state funding to allow us to support this statewide infrastructure. And so it would be really exciting if this was passed. I believe that the Alliance has sent out a lot of communication and information about that, but this is where we think if we could get some state funding for this, that would certainly create a more sustainable system for CHWs and how we can support the profession. And then also we see a really big calling from other grant opportunities that exist, specifically from CDC, where they're really calling out CHWs as a key piece to healthcare and healthy and safe communities. So we are really excited about seeing that, and we continue to write in CHWs and CHW activities into many of our grants that we're applying for on the state level. Next, we applied for a more researchy kind of grant through the National Institutes of Health, where they would allow us to explore reimbursement and other factors of CHW success and satisfaction, including different reimbursement models, which we acknowledge is a big barrier to really furthering the work of CHW. So we would like to try to support different reimbursement models that could better support the profession. And this is being done in partnership with the University of Minnesota. And we should hear about this grant in April. So we're really excited and our fingers are crossed so tightly for this grant. And this brings us to the HRSA grant, which is why we're all here. So HRSA stands for the Health Resources and Services Administration. It's a federal group that provides funding for health resources and services. And they put out this opportunity for funding to support the CHW profession. And they really want to see more CHWs out there. They want to see more CHWs with a certificate or a certification. In Minnesota, we have a certificate program. In other states, they have a certification. But this federal grant wants to support some system of certificate for CHWs to increase the number of CHWs that exist, and also to increase the places where they're employed. So they have required an apprenticeship program to accompany this grant funding, which is really exciting. And the more that we've learned about what an apprenticeship is, the more we see it being a great potential kind of entryway for CHWs into many, many different types of businesses and agencies and organizations. And this grant also focuses on training of CHWs and other health professionals that would benefit from trainings, but we're focusing on CHWs and also looking to translate materials. So I'll go into a little bit more about each of these sections now. So a very, very large focus of this grant funding, which is $3 million over the next 3 years. We're at about the half year mark right now in our first year. We have proposed that we will provide scholarships for about 90 students a year to pursue their CHW certificate. We are allowed to provide scholarships for a certain amount of money. I think it's $3,750 a year, which would cover the tuition portion for the certificate program at most of the institutions around the state that offer the certificate program, and would allow for a little bit, probably extra after tuition is paid for, which we are allowed to use for different purposes that have historically been barriers to certificate completion. Things like access to Wi-Fi. So with that money that is left over after tuition, we can pay for Wi-Fi access or transportation. The certificate requires a field placement experience. And so we could fund gas for driving there or a bus pass, things like that. We also will be providing everyone who goes through this process or through this scholarship program registration to the CHW registry that is run by the CHW Alliance, because we see that as a great way to keep CHWs within a network, share information, share resources, and we want to make sure that every CHW, definitely every CHW who has a certificate and other CHWs as well, are part of this registry so that we can continue to find ways to support them. And then I just lost where I lost my usual spiel with this. So the registry, and then also school supplies. That's right. Things like a Chromebook if needed to attend the certificate course. So we think that will be a great way to increase the number of CHWs that are in Minnesota with the certificate. And all of the schools are working with us. So someone will apply to the school for the program, for the CHW certificate program, and apply for the scholarship program. And we're working with the schools to really coordinate this opportunity. The second piece of this grant program is that apprenticeship program, which, like I said, we are really excited about. We're working in partnership with the Department of Labor and Industry, and they are the agency that oversees all apprenticeships. And usually when you think about apprenticeships, I believe plumbers have to go through an apprenticeship, carpenters, a couple other professions. And so they are they are regulated, these apprenticeships. And so we've been working with the Department of Labor and Industry to create a framework for an apprenticeship for CHWs that meets all of their criteria. They have a certain number of things that have to be done within an apprenticeship to get their kind of seal of approval. And these include training hours. There are additional training hours that come with being an apprentice, safety training hours also as an apprentice. You have to have a mentor on site, and the employer is in charge of making sure that all this happens, but you'll have a mentor on site who is there to guide the CHW through this apprenticeship year. It's a year-long program. And so the apprentice receives amazing on-the-job training as a CHW, mentorship, like I said before, but and an apprentice is hired as a full-time employee. So the apprentice applies and is hired to this organization or agency. And we are able, with this grant, to provide a stipend to every apprentice who goes through this program. And I believe it's $7,500 a year that is provided to the individual who is going through this apprenticeship program. And we think that that is just a great perk to starting your employment as an apprentice, as a CHW. The apprenticeship program each program will be offered through the employer. So it is an employer-based program. So different employers will come and work with MDH and the Alliance and the Department of Labor and Industry to get this registered apprenticeship in their place of business. There is the Department of Labor and Industry is very used to organizing these things. They have it down to a system. There are some criteria that the employer will have to follow as an apprenticeship site, but it is a fairly easy program to house in an employment site. With both apprentices and people who are using the scholarship or who earn the scholarship for a CHW certificate, there is a data requirement where we will have to collect a certain amount of data from people who are going through this program. That's a requirement from HRSA so that they can really find out how successful this grant program is. And that is where Nasadir comes in, and she'll be leading that piece of things among many other aspects of this program. The third part is the increased free trainings. We will be working with both folks within MDH and outside partners to create training opportunities for CHWs. We're aiming to create webinar type trainings that people can access at their leisure on their own time. And these trainings will provide a certificate at the end so that people's completion can be tracked, and they will be free of charge. And we are aiming to address topics that are of interest and of need to CHWs. So we will be reaching out to find out what those topics are and how we can work together to provide valuable trainings. And then the last piece is that we will have some funds to support translation of materials within the certificate program, which we think will address another barrier of people completing the program so that materials will be in various languages. And this will also provide materials for CHWs to use when they're working with clients and patients as well. So that was a lot of information, and this is all being done in partnership with the Alliance. MDH is doing some of it, but the Alliance will really be the face of this program in many ways, organizing the scholarship application and offering support to CHWs who are going through this process. Angela, did I cover everything or is there something that I missed?
You're doing good so far.
Thank you. Thanks. I think, I wonder if there are questions or if audience members want clarification on anything. Like I said, I just sped through it and this project has been living in my brain for a long time. So things make sense to me, but they may not make sense and they come out of my mouth. So I'm going to stop sharing my screen so that I can see people's faces, but I do see that Melody has her hand up.
Hi, yes, I'm Melody, and I was just wondering, so if the students get the scholarship for the program, does that mean they're automatically moved then to the apprenticeship program, or are those two separate things?
That is a great question and so important to clarify. They are not linked. So people who go through the certificate, who earn the scholarship, will have the opportunity to apply for the apprenticeships. But people can also just apply for the apprenticeships if they already have their certificate. The piece that the apprenticeship will require is the certificate. So either someone will be going through the certificate program and they can become an apprentice in as their field placement, or they can already have earned their certificate and apply to be an apprentice. And then it's up to that business to hire the apprentice so that we are separate from that. I hope that answered it.
Yes, thank you.
Okay, great. Peter, I see your hand.
Thanks. I wasn't entirely clear. You said something about the apprentices get $7,500 a year. Is that their pay or is that on top of what they're getting paid?
Also very important. Great. It is on top of what they're getting paid. And the reason, so I'm not sure of HRSA's reasoning behind offering that stipend. You don't ask questions when they're willing to give money away. But one piece that an apprenticeship, one detail that an apprenticeship must have is a wage scale salary. So the apprentice comes into the position making less than what they will make at the end of their year. There is no requirement for how much less that is, but they must make less. And then at 6 months, they have a review and they get a raise. And then at 12 months, when they conclude their apprenticeship, they must end their time making a living wage, is the terms that are used by the Department of Labor and Industry. But the numbers for that are not determined. It just must be a scale. And so I think that HRSA must know that, they know that there's a scale. And so to give that $7,500 is to make up for the fact that you're making less at the beginning of your time.
See that? Well, I get it that you're trying to get more people into the profession, but if someone starts out getting paid less, I mean, that seems like it's not like the pay is so wonderful to begin with. But if you're going to start out getting less, I mean, that seems kind of like you're discouraging people from joining the profession.
Yeah, yes, there are certainly some things that could have been improved by this program, but those are the HRSA rule. We're just following our funding outlines, but you make a great point.
I don't want to be the only person asking questions, but also when someone enters the program, when they get a scholarship, is there any money for them to live on, or is it just going to cover tuition and fees?
It will cover tuition, and then anything that's left over from the tuition will be able to cover those specific things that HRSA is allowing us to spend on, which is Wi-Fi, transportation, and school supplies. And so it is not much that's left over after tuition. That is fully acknowledged. But by not paying tuition, folks who are going through the certificate program will be saving, 3,000 plus with the scholarship.
Yeah, because again, that's I'm on Social Security, and I was when I went to school. But if you're not on something like that, you have to work full time and then go to school on top of it. I mean, it seems like that's sort of a missing piece. Like, again, provide access. I mean, I suppose people can apply for other scholarships that may a Pell Grant or something that might be money to live on. But that, if you're really trying to attract people, you have to make it so they can afford to go to school.
Yeah. Yep. You make a good point.
Okay.
I mean, we're just doing the grant that we're provided. So, but
Yeah.
you do make a good point. Megan.
Yeah, hi, thanks.
Hi.
I was just wondering, how do students access the scholarship funds? Do they get accepted by the school first, or do they apply for the scholarship separately from the school?
Great question. I believe the system is going to be that they must apply to the school and be accepted by the school, and then there will be a scholarship form that they can complete, which the Alliance will then process and take care of payment. Because with this scholarship, like I mentioned, folks will have to provide us with some data. They'll have to agree to be contacted a year after they graduate so that we can find out where they are, how they're using their certificate. So there are a few things that folks will need to agree to when they receive the scholarship, much like many other scholarships, I think, for other academic institutions. But it'll be two separate scholarships, and we will pay. I believe the Alliance will be paying the school. So the bill will come to the Alliance and they will pay the school. So it will not come to the person. It will just get paid directly to the school.
And so does the student then go to the Alliance website to apply for the scholarship, or is it the school that goes somewhere to get the scholarship funds? Who initiates it?
I believe what will happen is that the link to the scholarship will be on the CHW Alliance website, but all of the schools are in partnership with this. And so they will also be able to guide students to that scholarship link.
Okay, cool. Thanks.
Sure.
I think Cindy wanted to chime in. She's one of the faculty members at Normandale.
Hi, yes, this is Cindy. And I just wanted to say that to piggyback off and to support Catherine and the Alliance, Angela and Ann, and the other people who have been hired, all the schools across the state who offer the certificate have been working closely with Catherine and this grant to support students. And I know one of our advisors is on this call as well, Melody. So we're trying to make sure that enough people on all the campuses that are offering the certificate are well aware that we're in partnership. So if we have a student that needs the scholarship or hasn't applied, or we have an opening or needs to apply for a FAFSA for financial aid, that we're picking them up and getting them into the services that they need. So just to reassure people that there's a ton of resources at all points for the student.
Yes, and also the Alliance is in the process of hiring for positions for this partnership to support and help things go a little bit more streamlined. So we have started interviews for our program manager position for the HRSA. Also, we will be starting next week our apprenticeship interviews that we had opened up, and we have a student coordinator position as well that I will be transitioning into that role. because I already work with interns from various sublets. And so it will be just a lateral movement for myself. So we are working on those areas, as well as the scholarship forms and our website to be able to accommodate the demand and other things. So we're really diligently working behind the scenes.
I wonder if I could ask a question. I'm not sure how to raise my hand, so I apologize for not being politically correct. But I'm wondering if you can talk at all to the employer side of that apprenticeship in terms of, I guess I would be in a position of potentially hiring community health workers. And in fact, I have existing staff who I think might be interested in gaining that certificate. What does that mean for me as an employer? Is that something that I need to apply for? When will I learn about that, or where?
That is a great question. And you bring up kind of two great points there. So we see this scholarship opportunity also as one for employers, because we think that partnering with employers to have you send your people who would like to get the certificate, you are a perfect person for us to be talking to say, let's get in touch with your employees and see how they can go through the scholarship and have a supportive employer as they work through their certificate coursework, because we see that as being kind of, triply supportive of them working through this this program. As Peter said, he brought up the good point of having to work while in school, but if they have a supportive employer, that would be amazing. So we would love to talk about that. But then as an employer with the apprenticeship, that system is all figured out. We would just need to connect you with our Department of Labor and Industry contact, and they have it all laid out of how you would become an apprenticeship site. And if it worked to have your folks who are then going through the certificate program then become apprentices at your site, that's a perfectly fine situation as well. And we would work together to, make sure that the compensation happens for your employers or employees. We held an info session with the Department of Labor and Industry, and I have it recorded. So if I can figure out how to get a large file someplace for you to access, I can also share that with you, and you could listen to it and gain tips on that too. But if you'd like to go straight to the source, I can also get a meeting between you, me, and Leslie Philman, our contact at the Department of Labor and Industry, and talk with you about that too.
Yeah, I'm open to either. I would just like to have a sense of, as the employer, what I'd be in for and what sort of hours of commitment and all of that sort of thing for both myself as well as the people going through the process.
Great. I'll put my email in the chat, and also Angela and Ann have it too if you don't get it off the chat. And we can get in touch about that, and I can either get you the video or to Leslie. That'd be wonderful.
Awesome. Thank you.
And I saw Kim has her hand up.
Yeah, I was just wondering, so I have had my certificate for a few years now. What is the benefit of doing the apprenticeship, or wouldn't there be for me? And if so, how would I bring that to my employer? Like, what can I tell them the benefits would be? Does that make sense?
Yeah, it does. I think it would depend on kind of what type of work you're doing right now. I mean, the benefit of it would be if you're not doing CHW work right now, you could go through this apprenticeship and have a year's worth of on-the-job training that would be, CHW training, CHW focused training. Your employer would have to balance, you know, whatever responsibilities they have as an employer. I don't think that they're huge, but they would have to balance what their responsibilities would be with the benefit of you going through and having this mentored apprenticeship experience. And if they could handle the wage scale situation, the benefit to you would be that, you know, you would qualify for this $7,500 stipend.
So they actually, through a grant, paid for my CHW. And I have been practicing as a CHW, billing and getting reimbursement and all of that already. So maybe not a good fit for me is what I'm thinking, or am I missing something?
No, I don't think that you're missing anything. I think probably that isn't the situation that would benefit the most from this. I could see you being a stellar mentor, though, if they wanted to do the apprenticeship for someone else. So
Sure.
yeah, right. Like you need more work with it. But yeah, I don't think that this would be a fit for that situation.
Okay, that's what I kind of figured, but I just wanted to make sure I didn't miss something there.
Yeah.
So do they
Thank
get anything for a benefit if they would choose to have? Because I know that is something they have talked about, is training more of them.
Mhm.
Do they get a benefit if I would mentor?
You know, I think that at the mentorship or the apprenticeship program in general, the way that Leslie, who oversees apprenticeships, has really spoken about it, is that it provides employers with really well-trained employees after a year, because they go through extra learning, this structured mentorship program, and they can guarantee that they will have a certain number of skills at the end of the year. And so they have really strong employees at the end of this apprenticeship. And I think that folks who are entering the job as a first-time CHW would benefit from that type of entry-level structured program.
Yeah, I could see that.
Yeah, so that's how I would see it.
Okay. Thank you.
Sure. I think Erin was next, and then Monisha.
Yeah, so I live in Bemidji. I work at Stanford Bemidji, and I have an employee. It's an internal employee. I've got her hired. She's signed up for the classes. She's going to do on-site training and shadowing. But my question is, when I reached out to the technical college, they gave me the invite for this meeting, and they didn't really know how to apply. So I just don't want to miss the boat. Is there they should be aware, or they're going to be aware, like what is like a rough timeline of when I should be looking for an application from them, because they just didn't know much about it.
Yep, I believe, and Angela can correct me, that the scholarship should be up and running for students who will start in the fall. And and there's a chance that it could be for students that are starting in the summer. We need to get the Alliance, and the MDH just needs to line up the systems. So if your employer is, if your employee is starting in the fall with the courses, we should be, the scholarship will be coming late spring, early summer.
So I would just reach out to the technical college for that then.
Yep, they will know about it, but also the Alliance will have they'll have the link ready. And since you're on this call and registered for this meeting, I'm sure that we will get your information.
Perfect. Okay.
And alert everyone when the link is live.
Sounds great. I just don't want her to miss out, and I
Yep.
imagine it'll fill up fast. So
Yes, for
And
sure.
also, if you're interested for yourself, please leave your information, your contact information in the chat. Or if you're interested in the scholarship for someone else to be referred, please also leave that in the chat. Our interns will be recording that, And so we will devise a list because we're in the middle of putting these processes together and hiring. So we have a lot going on right now to make sure that all of the areas that we need to complete are done. So we'll have a streamlined system for the applicants and the scholarship process. We will revisit this topic again in June. So we'll have another informational session because the desire is to have everything up and going for fall. So we will revisit all of this again. We will come back. And at that point, we will also have the Alliance staff in place, hired, trained, and in place to implement those processes. Please also put your email in the chat where we can get in contact with you and you'll get notifications from us. And so we'll take a second because things are going by really fast in the chat for me to keep up with. We'll pause just for a second. I see everyone's hands up. I'm gonna divert to our intern Celeste and have her read off any questions that we have in the chat so we don't, overlook anyone. Celeste.
Hi, yes. There's a question from Melody. I think it may have already been answered, but I'll still read it aloud. Since there is still hiring going on and such, when is the soonest these scholarships will be available to apply? For example, if students start the program in the fall, will they be eligible for the scholarship? We have students registering for fall classes now.
Yes, so they will be, the scholarship application will be available late spring, early summer. And so they will be able to apply for the scholarship and it will all be set for the fall classes.
And a good step now for students to take is to apply for the schools of their choice. Because that would help you get, the process started on your end as all of the other processes connect and catch up with each other. Celeste, were there any more questions in the chat box?
I don't believe so.
All right, well, we can resume taking the raised hands, Catherine.
Great, so I think Monisha was next.
Hello, Catherine.
Hi.
Hi, Angela. Great presentation so far. I'm excited for this opportunity. I'm a community health worker, so I'm sharing this information for sure with others that are interested. But my question is, so kind of along the lines of what Peter said, we know that there are competing things that happen when it goes to school. So wondering with this HRSA funding, if you are eligible for financial aid, could you still apply that to some other things, such as what you mentioned, the laptop and other things, if there's a possibility to use your financial aid alongside this funding source?
I believe so.
Okay, thank you.
That's our understanding as well for now. Of course, HRSA has the last say because each school tuition is price is different. And so it may not cover, at one of the schools that may have a more higher tuition, that individual may have to apply for FAFSA or some other source of funding. And then this will be just like any other scholarship that's piggyback to that.
Okay, thank you.
All right.
Okay, and Vanya. Hello, another familiar name.
Hi, Catherine. Good to see you. I'm actually running errands right now, so I'm just trying to keep down on the amount of usage I'm doing with my phone. And I've actually never raised my hand by mobile phone on Zoom before, so thank you again, Celeste. My question is around the employers. So I'm wondering if the employers that are participating in the apprenticeship program are familiar with what the role and scope of practice are for CHWs, because so many times we hear about employers wanting to have an employee in a CHW as part of their team, but it ends up being that the CHW is doing a lot of roles and duties that are not applicable to the CHW training. So that's my question.
Great question. So they should be, because once they see what's required of a CHW to experience as an apprentice, It is very detailed and it is based off of the certificate curriculum. All of the schools have seen it and approved of it. And so the tasks that an apprentice must complete during their time are very clearly within the scope of CHWs.
Okay, thank you.
Sure, thanks. That was a great question.
And also to support that, the field experience apprenticeship positions will also support those relationships and help conduct those outreach and recruitment mechanisms and expand the knowledge of the CHW field across the platform. So you have MDH on their part, you know, with the promotion and the informational sessions. You have the Alliance as an entity as well with our partnership and our positions that will support those to bring clarity and also workforce readiness and organizational readiness for CHWs. I love it. Keep the questions coming. Do we have any more questions? Is Sean?
Yeah, I have a quick question. I'm not sure how to exactly frame it, but I was just wondering if a CHW graduate gets an apprenticeship and that person separates from that apprenticeship for whatever reason, whether it's they didn't work out, they don't like the position, or the employer lets them go for some kind of reason. Does that funding stay with the employer, or does it follow the pay or the student, if they end up being employed at another organization?
So that is an interesting question. I think that the funding for the apprenticeships never goes through the employer. So it's directly from the Alliance to that person. So the employer would not keep it. I think that is a great point that we will have to discuss when folks sign on to the apprenticeship program and receive that funding. That will be something that the Alliance will most likely need to discuss with their legal department about, what would happen and what could happen with that funding. It's a great question. We don't have a full answer on that one.
We're still working on those components for the apprenticeship position as well as the CHW certificate. So if you have a CHW that encounters some barriers and not able to finish their certificate program, we're working on those mechanisms with our legal and compliance for that. Celeste, are you able to read a question that came up and went too fast?
Yes, I just saw it. So this is from Anne for everyone. How do we promote more CHW positions? Ideas? We can educate students who then need jobs. How do we get more employers and more CHW jobs?
Definitely so. We need jobs at the end of all this education. We need sustainability. So we don't want to have a stockpile of CHW certificate holders and no employers to support that. So yes, we're asking you guys as the network and as to help us along with this promotion. If you know someone, or if it's a fit for yourself, spread the word. If you have an employer that you think might be interested or maybe not, talk about CHWs and the value of CHWs and what they can bring to their organization. So it's a collaborative effort on all of our parts.
If I could just respond to that, this is Bruce Sherman, and I'd like to respond as an employer. I do think that given the work that many of our staff are doing, I think that it overlaps in a big way with what the work community health worker is. One of the dilemmas is that the lack of ability to bill for those services, given the current billing structure, means that essentially we have to have a position that can use that community health worker description, and we have to find grant dollars or contracts to pay them. And so it would be a whole lot easier to promote community health worker employment if there was a reasonable accommodation for retrieving payment for them. So I'll just throw that out there. I'm sure you can have that done by Friday.
Yeah. Yes, no, we see that as a huge barrier, and at MDH we bring that up in every conversation that we can, with every person who might listen, or even if they don't listen, we say it, because we do also agree that the reimbursement piece is a huge barrier. So I, fully acknowledged and agree.
Yes, and thank you, Ruth. Angela asked me to come on and answer a little bit too. We are working with DHS to expand and increase reimbursement, and there will be more information coming out about that as we get further into this. And also the legislation, the current Senate file, I think I'll look it up. It's in the chat, but if that would get passed, the Alliance would have some funding that we could really devote to working on reimbursement with our partners at DHS, because that's where the decisions are made about reimbursement. So we know this is a barrier, and we're working on it. And any help you can give us with the legislation that would help us have resources to do that would be really awesome. Senate File 2995, Angela's put in the chat. So the governor did include CHWs in his budget, but they have to be put in the legislative process. So that's the Senate file to do it.
And individual letters of support to your representatives, organizational sign-on letters would really help. In-person testimonies, I know they may be a little intimidating, but I did my first last week. It wasn't as intimidating as I thought. And we just have to be proactive about this. We have to show up. We're in a battle. We have to show up for the fight. So we have to, shift these thinking. We have to make a little bit more noise about who we are and where this profession has come. I see Carrie in hands up.
Yeah, I just wanted to add on to the employer part of this. I've been in CHW school and I have my certificate. It seemed to be kind of difficult to find an internship location. And I think as taking on interns as an employer and a supervisor now, it seems like we do need a little bit support with that, where they're coming up with a position at a place we almost need some financial resources to take the time to develop a position or an internship or what you guys are doing. And I'm kind of fearful about so many CHWs coming along in addition to the ones we have now that are looking for work, and being able to find jobs and also being able to be paid what you're expecting them to be paid. Is there any support with the employer? And you commented on that a little bit, but I'd appreciate some of that coming the employer way as well.
Yeah, I think that that's a great point as well. And part of our hope with this is to be able to publicize. I think maybe Shalonda just wrote in the chat as well, really being able to use this as a point of communication and sharing how valuable CHWs are, and really bringing light to the role that they can have in so many different spaces. one of the things that MDH can do is use our communications office to spread the word. And I know that that certainly does not equal spread the dollars, but we're doing what we can to bring attention to this important profession. But I do think that you make a great point.
The other thing I would say, Carrie, is, and this isn't really addressing what you're asking about, we do have other help. We have an organizational readiness template that we go through with people who are starting CHW programs or just adding a CHW. So we look at other ways to support employers, but we know that it's reimbursement and being able to sustain those positions, which are going to create the positions. So we're going to have to fight for that reimbursement and fight for funding for CHWs.
And as Ann put in the chat, we are on the governor's line item in his budget. And we have templates of letters. You can just contact us and you just fill in your content. We have everything else to kind of help you, guide you along the way. Those conversation starters, we even have talking points. So it'll be less intimidating for you, and it'll be a streamlined way of connecting with policymakers, lawmakers, and all their officials.
And I know not everyone is into policy, but this is how the process works. Last week, it was heard by the House, and the House did not include the CHW line in their final budget bill. But that's the testimony that Angela gave. She was at the Capitol to testify on the House file. The Senate has included the CHW line item, so our senators need to hear that it's important to keep that in there. And the final negotiations will be done between the House, the Senate, and the governor. So it's good for your representatives to hear as well. So.
Absolutely. And we're stronger in numbers. So if they have in-person testimony, again, I will be there knocking at their doors. So if anyone would like to join me, please connect with me and we can follow this bill together. When you go on the website, they do have literature about how to follow a bill and understand, because this was all new to me and intimidating to me in that initially, but after learning and getting involved in it, I was like, okay, these are our constituents. They want to hear from us. And if we don't talk to them and let them know our needs, they just go unheard. And so I welcome anyone that would like to join forces with me if we do get an opportunity to go again. Anisha.
Yes, I'm glad that you mentioned part of my question was how do we as CHWs join you as you go forward and testify and do things like that, because we are powerful in numbers. And so that was part of my question. My other question, just piggybacking off of what Carrie said as being a part of an employee as well. What is the paperwork is there any paperwork on the employee side as far as the employer side, as far as the apprenticeship go? Because you said there was very strict guidelines, there was this and that. So what all does that entail? Because I know that when I worked with getting interns into programs, it was like, what paperwork the director was like, what all paperwork we have to do. And I can advocate all I want, but if they have too much to put on their plate as far as the paperwork goes and things like that, they're kind of hesitant. So can you answer some of the, what that actually entails as far as the paperwork on the employer side?
Yeah, I can do my best. I have not seen the actual papers that they ask employers to fill out, but I do know that they try to keep it a very reasonable amount. And actually it's only companies that have like more than 3 apprentices or something that have to go through a like quality assurance check or something like that. So so they do try to keep it very reasonable. If I can ask our contact at the Department of Labor and Industry for a more official outline on what the employer is actually required. Or like I said, I think it was Ruth, I'm happy to also set up a meeting between employers and the Department of Labor and Industry to get it straight from the source.
Sounds good. And then on the CHW side, how many, is there like touch points throughout the apprenticeship? Because you said you wanted to make sure after the year long, like you're tracking them or something to that effect, to get the outcomes or whatnot for HRSA. So are there certain touch points, 3 months? Are you keeping up with them, keeping track? What is it required on their end?
Yeah, there are set times that we check in, and that's where this person who's being hired by the Alliance will come in to be the person who kind of says, hey, how are you? How's it going? Can we support you in any way? And then I believe it is 1 year after the program is ended, it's another check-in that just says, are you still using your CHW skills? That kind of thing, but it is not a heavy lift in that way.
Awesome, thanks.
Sure.
Celeste, do we have any questions or comments in the chat?
I don't believe any questions. There are some personal comments to people, mostly words of encouragement, which is always wonderful.
Yes, absolutely. And thank you everyone for extending your willingness to support this bill and to support me, and as well as the Alliance and MDH in this cause. In the meeting minutes, it will be the agenda for today. I will send out the template links and everything like that that is needed to contact your representative. They also have the links where you can go on and actually find your own set of representatives in your area or your district where you live, as well as the local Minnesota Senate here in Minnesota. So if you have questions, feel free to reach out to both Ann and myself. Ann is kind of like my coach that's been helping me learn all of these criterias and how to maneuver in this space. Yes, so definitely feel free to reach out to me in response if you have any questions. And also put in the comment box to remember that this is a state legislation and not a federal. So we do not need the senator in Minnesota. Is it Washington? It's for Minnesota representatives. Awesome. So I will save the chat as well as a transcript of this meeting together, and then I'll have our interns will record all the information off of there, and I will send out meeting minutes as a follow-up for our conversation. Do we have any more comments or questions? And we would definitely let you know if we're able to give testimony again. And a quick reminder, testimonies requests are like literally the day before. Like within 24 hours, you'll know. I didn't find out. I was receiving I had a network of coaches, which was really, really helpful with me to help me put my define my script, to walk me through the environment at the Capitol and expectations. And I was literally notified, I believe at 5:30 the day before, and had to be down at the Capitol the next morning. So what I did was, once I got notified, I just jumped in my car, drove around to see the access, how do you get in, what building is what, and found out my room. And I went online and did my own research. And then I kind of had breakfast down the road from there to kind of, calm myself. And the testimonies are initially you prepare for 2 minutes, and then when we got into the actual legislative floor, because it was a big bill that they were presenting, the testimonies was reduced from a limit of 2 minutes to 90 seconds. So I was like, I have this content that I practice, and it was exactly 1 minute and 53 seconds. And I knew it for a science. So what do I eliminate? What do I keep? And so I'm texting my coaches. Ann was one of my coaches. I'm texting her. So what do I do? What do I say? And she helped me rearrange my script. So therefore the important pieces that we really wanted to highlight was the CHW stories. So I'm comfortable there. I know this like the back of my hand. You know, I have a caveat of stories of how I help my clients and patients. And so I just let that take over, and I was in my comfort zone, and I just talked about my experience and how I helped an individual and how I supported my other colleagues, such as nurses and other clinicians that were on my team. And that's why I just relished, and it was not as intimidating either.
We have a comment from Anne in the chat, and it says that testimony is limited to 2 minutes. You sit at the desk and speak to the committee when your name is called. So just something to keep in mind.
And I have a video. I'm just trying to, we recorded it on a phone. And so I don't, sometimes when you send a video, it trims it down. And so I'm trying to figure out how we can get it transferred from a cell phone to maybe an email so we can look at it and see if we don't lose any of the content. And then you can to actually see someone in real time doing a testimony. I thought it would be helpful for those that might be interested. We have to get our interns to help with uploading the technical to YouTube or Instagram. I'm not tech savvy at all. As you see, we have Celeste is manning the chat. Yes, Marisha. I see your
I
hand.
was gonna say, I think that this is wonderful, the content as far as this goes. I know it's not the HRSA topic exactly, but I think that it's important to train CHW around policy and what, you know, as you said, you learned a lot. If we could get some coaching or some training around a circle, what is it called? The CHW circle roundtable discussion about that. I think that is important. And you may have done it already, but I would love to learn more about how do you prepare, since you said it's kind of last minute that you get, you know, the information. So how do you prepare for that?
Absolutely. And so what I'm going to send in the follow-up meeting minutes will be our template and our guide. And so that can help you, you know, kind of formulate your message, and then you just personalize it. So I can definitely do that. And then we will revisit it at the circle again. We was that January or February we did a session as the legislative session was opening. So we did do it then, but we will revisit that and maybe take another hard look on how we can present it in a way that, you know, CHWs can learn and be comfortable in that space.
Thank you.
Do we have any questions or comments?
We don't have any in the chat.
All righty. Thank you so much, Celeste, and thank you, Shalonda. Thank you to our guests, Catherine and Nasadir, and Anne as my colleague, but she's normally not at the circle with us unless we asked her to come in, but she's always welcome. So thank you, everyone. Thank you for all those in attendance. We can adjourn this meeting and give you back a few more minutes of your day. Hey, Peter, how are you? Good to see you.
All right, thank you guys. Have a good day.
Bye, Francis.
Yeah, take care, everyone. Nice to see you too, Angela.
Nice to see you, everyone.
Thanks,
you.
Angela. Bye.
Bye.